Hello, everyone, and thank you very much for inviting me to the second annual Youth Voices Summit. I'm really pleased to be here with you today, albeit virtually. So a few introductory remarks on my side on the contribution of youth in healthcare. As you know, this generation of youth has grown up with digital, is technology savvy, and have now lived through one of the most impactful global health events we will ever have witnessed in several centuries, the COVID-19 pandemic. This may make young people more sensitive to the fact that health and development and economic growth are intrinsically linked. They may also realize that without systems and societies that are geared towards good healthcare, we are much more at greater risk from threats collectively. Also, the growing population, climate change, international travel, gender equity, diversity are all issues that youth are much more attuned to these days. And we can also mention issues that are impacting the overall health. Why is this important? Why is it important to include youth in healthcare governance? We need to seek new and different ways of working together, given the collision of all these issues and their impact on health, the competition for resources, squeezing of budgets in the context of wars and the economic crisis, and the environmental pressure. There is now a greater need for innovative working and collaboration. Each one has a role to play within the global health community, and rather than being driven by ideological positions, youth can be much more agile on leveraging everyone's skills and capabilities and focus on what each player can contribute to and what each player can bring to the table. So I would like to expand a little bit more with some examples on youth initiative kick-started at IFPMA. The first one will be the Africa Young Innovator for Health Award that has been created in 2020 to help young health entrepreneurs from Africa with financial and in-kind support to develop their business. This will build on the simple observation that there is a massive amount of entrepreneurial skills, knowledge, and innovative capability across the continent, but they are not fully leveraged. So we really decided to play our part in investing in the human capital of Africa. The second project that I want to mention is the Women Innovators Incubator. This is a spin-off of the award that I just mentioned, and it aims at addressing the gender imbalance that exists in Africa's health innovation landscape by supporting female health entrepreneurs to bring their innovative ideas to life. And I just want to make this quick comment, but women make up for the majority of those who are entrepreneurs in sub-Saharan Africa, but they continually face significant barriers like access to funding, skills gaps, exclusion from key networks, and overall participation in competitive environments. They are all key ingredients for a successful business, so it's for that IFPMA wanted to support them in particular. I would also mention the Hypergroup that has been created in 2020. This is a young independent group of healthcare professionals from the biopharmaceutical industry, and they are discussing prominent global health topics, and they make the case to include more youth, gender balance, and diversity in how health is governed, by whom and for whom. So the objective is really to empower and connect young workers within the industry to maybe in the longer term to propose policies and to put together calls to action. So it will be a forward-looking goal, but that can be potentially powerful. By the way, I invite you to follow the LinkedIn page where you can find the latest news about the group activities, and please feel free to reach out. I would like maybe to mention two other things that are a little bit more academic oriented, but IFPMA was involved in the fellowship program with the Chatham House. And it's really aimed at, again, empower the youth and open their horizons to how different stakeholders, including the private sector and others, can bring to topics like UHC, which are often perceived to be the narrow responsibility of government. How we nurture those future healthcare leaders is really important. And these programs really enhanced their exposure to the workings of international institutions and multilateral ecosystems early on in their careers. They were becoming more familiar to the global health diplomacy, living in practice. And now we can observe that fellows supported through the Chatham House programs are now making a difference in important public health organizations like the Africa CDC, some national disease control programs, academia, health NGOs, or African media. And I would just like to mention one example, and this example is Ama Pokuafeni, who was a research fellow who has been recently nominated in the Africa Health Agenda International Conference Commission as a commissioner on the state of UHC in Africa. So the commission will review the continent's progress towards achievement of the UHC targets by 2030 and provide recommendations on leadership, accountability, technology innovation, and security to help guide the continent towards achieving UHC targets. The last thing that I want to mention is the Graduate Institute. That is a Geneva-based school dedicated to global issues, and obviously global health is a central theme for which their students can learn through a dedicated path. But more importantly, the Institute is facilitating internship and work opportunities in many health-related organizations such as IFPMA, Alliance for Health Promotion, UNAIDS, MSF, UNDP, and so on and so forth. And its strategic positioning in Geneva allows it to really support many young professionals to enter international organizations or groups dealing with global health. And I'm sorry, but we have plenty of initiatives, but the last one will be the Geneva Summit on Africa, that is organized by the African Students Association, which really aimed at bringing a new voice and change the narrative on Africa. And I just want to say that on the contrary to what has been said or even observed in the continent during the last 2 decades, the current realities in Africa reflect a continent on an upward trajectory, and mainly thanks to a vibrant youth, young population. And we are convinced that this kind of platform can upgrade the scholarship, but also increase capacity in the continent. So with that, I wish you a wonderful summit, and I wish you a wonderful day. Thank you very much.